Welcome back to Medicine 101, the podcast where we break down the medical issues that shape our everyday lives, clearly, honestly, and without the jargon. I'm your host, Johanna Sessi, and without further ado, let's dive into today's episode. Today's episode is one that many of us never expected to record. We're talking about measles, a disease that people believed was eliminated in the United States, something firmly locked away in history books and black and white photographs. And yet, here we are in 2026, watching measles make a very real and very dangerous comeback. It's spreading rapidly, hospitalizing children, overwhelming public health departments, and placing new strain on an already stretched healthcare system. This episode is based on a recent article by The Guardian that lays out the scope of the growing measles outbreak across the United States, and more importantly, what the outbreak reveals about vaccination, misinformation, and just how thin the line is between public health success and public health failure. So, let's start with the numbers because they are alarming and they tell a story that's very hard to ignore. In the state of South Carolina alone, measles cases have surged to 664, more than doubling in just a few weeks. And this is not an isolated hotspot. The virus has spread beyond South Carolina into the states of North Carolina, Ohio, and Washington. While similar outbreaks are unfolding in Arizona and Utah, what we're seeing now is not a single flare up, but a web of outbreaks feeding into one another. That is no longer a local problem or even a regional one. What began in Texas 1 year ago, with just a handful of cases, has now spread to most US states. That's a stunning shift for a disease we once believed had been stopped in its tracks. And here's the issue, you may ask. The United States is now likely to lose its measles elimination status. That status meant measles was no longer spreading continuously within the country. Losing it is not a technicality or a bureaucratic footnote. It signals that measles may once again become a year round endemic disease in the United States, something doctors and parents have to think about all the time, not just during isolated outbreaks. But you may be asking yourself, why in the world is measles so dangerous in the first place? Well, let me explain. Measles is often misunderstood, especially by people who have never seen it firsthand. This is not a harmless childhood illness, and it is definitely not just a quote unquote rash. Measles is one of the most contagious viruses known to medicine. The virus can linger in the air for up to 2 hours, after an infected person leaves a room, if you're unvaccinated and exposed, there's about a 90% chance that you'll become infected, according to the CDC. That's an almost unmatched transmission rate, even compared to other well known infectious diseases, such as COVID 19. About 1 in 5 children with measles requires hospitalization. Complications can include pneumonia, brain swelling, which is often known as encephalitis, permanent hearing loss, and even death. During the original Texas outbreak, 2 young children tragically died. A very, very unfortunate reminder that measles is not a disease we can afford to underestimate. What makes measles, although especially dangerous, is how ordinary it looks at first. Early symptoms are very familiar to us as citizens, including fever, cough, runny nose. Nothing about that immediately raises red flags, right? The classic rash, the symptom most people associate with measles, appears later after the virus has already had time to spread. This means that people can unknowingly transmit measles before anyone realizes what's happening, especially in very crowded places in the public, such as schools, daycares, and healthcare settings, including hospitals and clinics. Although, who is being affected is another question that may arise. The majority of people infected during this outbreak are unfortunately children, and most of them were not vaccinated with measles, mumps, and rubella, or also commonly known as the MMR vaccine. In 2025, the CDC recorded 2,242 measles cases across 44 states, a dramatic increase compared to previous years. And already in early 2026, 171 cases have been reported in just 9 states alone. And that figure doesn't even include the most recent surge in the state of South Carolina. In other words, we're not slowing down, unfortunately, with these cases of measles. However, it is very important to note that certain groups are especially vulnerable to this disease. Children under the age of 1 are often too young to be fully vaccinated. Children with compromised immune system and those undergoing treatments such as chemotherapy for cancer may not be able to receive vaccines at all. Even in highly vaccinated communities, these individuals rely on herd immunity for protection. This is why measles doesn't just affect those who choose not to vaccinate. It places entire communities at risk, especially the most medically fragile among us. However, public health experts are very clear with this. Measles is a warning sign. Catherine Wells, who is a public health director in Texas, who helped manage the early outbreak of measles, describes measles as the quote unquote new normal for public health departments that are now forced to respond to preventable crises again and again. She also calls measles the quote unquote canary in the coal mine. So, why does this matter? Because when vaccination rates fall low enough for measles to spread, it means we've crossed a dangerous threshold. Measles is usually the first disease to return, but it's rarely the last. When measles breaks, though, it signals that other vaccine preventable diseases, including rubella, polio, diphtheria, tetanus, and whooping cough, may also soon follow. Virologist Dr. James Alwine puts it very bluntly and clearly. Quote, when measles comes back, it means your vaccination level is so low that all the others will follow. So, you may be asking now, how in the world did we get here? Well, vaccination rates across the United States have been declining, in part due to an increase in exceptions from school vaccine mandates. But policy alone doesn't explain what's happening. Misinformation has played a major role. The article highlights the influence of Robert F. Kennedy Jr., who is the current Secretary of Health and Human Services, who has promoted vaccine skepticism for decades, particularly around the MMR vaccine. Despite overwhelming scientific evidence showing no link between vaccines and autism, emergency physician Dr. Rob Davidson points out that Kennedy
If
now
you're
holds one of
enjoying
the
today's episode,
largest public
please take a
health
moment to
platforms
subscribe to the
in
Medicine
the
101
world,
podcast
giving
on YouTube and
misinformation an
Spotify, as well
unprecedented
as follow us
reach
on
at
Instagram.
a very critical
All of our
moment
links are listed in the
for
description below.
doctors,
By
such as Dr.
following Medicine
Davidson, who has
101,
practiced
you'll stay up
medicine
to date on
for
clear, accessible
28
discussions
years
of
and
public health
never seen
topics
measles
affecting
because
our global
vaccines
society
just worked
at both
so
the
well.
national and
This
international
resurgence
level.
is deeply unsettling,
And if you're
and it
interested in
prepares
being
to
featured
treat
on our
a disease
Instagram,
that
we're
medicine
currently
already
hosting
knew how to
a current
prevent.
health
It feels
terms
like moving
breakdown
backwards.
series
He says,
where
it
we're
didn't
inviting
have to be
public health
this way, he
experts,
says.
students, and
It is a
advocates
gut punch.
ranging from all sorts of ages to share their research, stories, advocacy work, and or scientific discoveries. You can find more details on how to participate on our Instagram profile. As always, don't forget to subscribe, like, and comment. Now, let's get back into the episode.
Now let's get into the consequences in the real world. The consequences of this outbreak are no longer theoretical. In the state of South Carolina alone, right now, 531 people are in quarantine, 85 are in isolation, and 8 people have been hospitalized with measles. Doctors describe a feeling of standing on the edge of something worse, knowing that when they're seeing now may only be the beginning. Arizona has reported 217 cases and 9 hospitalizations. Utah has reported 210 cases. The Pan American Health Organization is now reviewing whether both the United States and Mexico should lose their measles elimination status. This is not a warning about what might happen. This is what is happening. There is, however, a hopeful note that we must remember during this difficult time. During the Texas outbreak, public health departments administered thousands more MMR vaccines than usual. Pharmacies saw a surge in demand as families rushed to protect their children. Some parents, who had never vaccinated their children before, changed their minds after seeing measles up close. As Wells recounts, parents said, quote, "This is real. Let me get my child vaccinated." Infants received early doses, school nurses reached out to families, communities mobilized. When the danger became visible, action followed. Vaccines worked again. What comes next, you may be asking? Well, experts are concerned about recent policy changes that are no longer fully recommend several child vaccines. Removing vaccines from recommendation lists can create confusion, reduce stress, and make life-saving protections seem optional rather than essential. As Davidson warns, the consequences could include more cases of meningitis, hepatitis, RSV, and rotavirus, diseases that vaccines had previously pushed into the background of our everyday life. Public health departments across the country are now preparing for outbreaks before they even happen. The solution, experts say, isn't just policy, it's trust, education, and clear communication. As Wells emphasizes, most parents across political lines believe in vaccines and they want their child to be protected. What they need is accurate information and reliable access to care. For decades, we lived in what experts call the golden age of medicine, a time when vaccines made deadly diseases disappear from everyday experience. But as Dr. Alwyn reminds us, these diseases were never gone. They were just waiting. Measles is not just a disease from the past, making an unexpected return. It's a warning about the future and about what happens when we stop protecting the progress that we've worked so hard to make. However, before we close, we want to be clear, as Medicine 101, regarding something. We believe that health is a human right, not a privilege, not a political talking point, and certainly not something that should depend on misinformation or fear. Every child deserves the chance to grow up healthy, and every community deserves protection from diseases we already know how to prevent. The resurgence of measles is not a mystery, but it's a warning. And the way forward is not guesswork or opinion. It's listening to science, to public health experts, to physicians, epidemiologists, and researchers who have spent decades studying how these diseases spread and as well how they can be stopped. Vaccines are not theoretical, they are proven life saving tools. And ignoring that reality puts the most vulnerable among us at risk. At Medicine 101, our priority is extremely clear. Preventing the resurgence of diseases like measles must come before misinformation, politics, or political agendas. This is about protecting lives, safeguarding communities, and preserving the medical progress that generations before us fought so hard to achieve. Thank you all so much for listening to another episode of the Medicine 101 podcast. If this episode resonated with you, please feel free to share it, talk about it, and speak up for science and for public health. Conversations save lives, sometimes more than medicine alone. Until next time, stay informed, stay curious, and please take care of your health. Thank you.
What are we doing? Where are we now? What is the reason why we're not get shut that down? Where are you lonely? What do you need? What will it take to make us fly right off the ground? Just like dust in the air, we're Catching the feeling right here and now. Somehow I feel that we are floating off the ground. Just like dust in the air, throw our worries away. We don't need them. No, we don't need them. Come on in, feel the rush. Let's get close and share love. Take my hand and toss the moon. Come together, don't let go. Light the sky, burn it up. We are young and beautiful. Take my hand and toss the moon. Come together, don't let go. Come together, everyone, everywhere now. Come together on the floor, on the playground. Catch the rhythm now. Turn the music loud. Come together like